Our first speaker is a doctor whose name is synonymous with breast cancer. She has practiced for more years than I have been alive, and I'm sure many of you present here today are patients of hers. Ladies and gentlemen, the incredible Dr. Anne Gudgeon.
Thank you very much for that wonderful introduction. I would like to thank the organisers for inviting me. It is an honour to be here. It's lovely to see so many familiar faces. And I would just like to share with you, I also have been on this journey about 3 years ago. I didn't do what I told everybody to do. So today what I want to do is just go through breast disease, just so you know where it comes from, and hopefully to pick things up early. At the moment we can't prevent the disease, but we certainly can treat it. And the earlier you pick it up, the better. I don't know if you can see any of the slides, but it doesn't matter because I will talk to them anyway. The breast basically is a gland. It sits on your chest wall, and it's there to feed babies. That's its function. It has no muscle in it. It's really made up of mainly fatty tissue, fibrous tissue that gives the breast its shape, and these little ducts that produce the milk and take the milk through to the baby to feed on. And it's those little gland areas that go wrong. Now, not everything that goes wrong in a breast is breast cancer. You can get problems with the breast right from tiny babies, and they can be born with little bloody nipple discharges, through to teenagers that have benign little lumps that think they're lumps and they're just breast development, to late teenagers, early 20s that have little, what we call breast mice, little round lumps that are very mobile, that are nothing to do with cancer, to problems that you get when you're breastfeeding with mastitis, to problems when you become late reproductive phase, early menopause, when you can get fluid-filled lumps, which we call cysts. And older women can also get problems that aren't breast cancer. They can get little infections around the nipple called periductal mastitis. So not everything that you feel that's abnormal in the breast is breast cancer, but that's the thing we all are frightened of. In fact, breast cancer can occur at any age. It gets more common as you get older. The little breast mice tend to be around sort of 20s, 30s. The painful nodularity, which is what most women come to see me about, what most women think is breast cancer, tends to be persistent, but disappears once you've gone through your change of life. Breast cancer is common. In fact, it's almost the commonest female cancer in South Africa. It's on a par with cervical cancer. At one stage, cervical cancer was more common, but breast cancer is now becoming very common. So what is breast cancer? Breast cancer, sorry, I'm going to turn this around so I can actually read it. The term breast cancer relates to a malignant tumor. There are benign tumors which are not cancer, but the word tumor is still used, and there are malignant tumors which we call cancers. And a cancer is an uncontrolled growth of cell. What happens, the genes in your cell control the cell, and it tells the cell once it's lived long enough. So all the cells in your body are programmed to live for a certain time. They die off, a new one comes, and that new one is the same as the one that's died. What happens in breast cancer, or in any cancer, something goes wrong with those genes that control the cell, and then the cell starts growing, and it doesn't stop growing. That's the difference between a cancer cell and a normal cell. Cancer cells don't die, which is why it's so important when you're treating cancer is to get rid of all those abnormal cells. So what happens is the cells in these little tubes or glands become slightly prolific. In other words, they become a little bit overgrown. Now, that can occur under many conditions. Often hormone changes can cause the cells to become a little bit overgrown, but it's a reversible situation. And if you withdraw the hormones or stop hormones, then the process goes back to normal. But there's something else that then changes that cell that causes this abnormality to happen in the gene that we call a carcinogen. That is just a fancy name for something that changes the cell to become a cancer. And that is a reversible process, not a reversible process. Once that's started, then you can't stop it. Breast cancer grows very slowly, doesn't grow quickly at all. What happens, you get this one abnormal cell that becomes two abnormal cells when it divides. Those two become four, and so on. So you can see the growth is what we call exponential. The more cells there are to divide, the faster it seems to grow. Now, by the time you have your mammogram, and they pick up a little lump of about 0.5 centimetre, you've probably had those abnormal cells around for up to 2 years, maybe more. And the mammogram will pick up the lump at half the size that you can pick it up yourself. So if a mammogram picks up a lump at 0.5 centimetre, then you will pick it up when it's 1 centimetre. And 1 centimetre of abnormal tissue has quite a few million cells. So what are the risk factors that are breast cancer? Well, obviously female. But having said that, men can get breast cancer as well because men have breasts. Rudimentary breasts, but they do have breasts. But for every one man that gets breast cancer, 100 women will get breast cancer. So it is far more common in women than men, but one mustn't disregard the fact that if a man comes with a breast lump, one must take it really seriously. Age. It's more common in older women. We say breast cancer is a disease of women who are postmenopausal. However, we see a fair number of young women, and when I say young women, I've seen women in their 20s and 30s and 40s that are young women with breast cancer. So never ignore a lump. Don't assume that it's benign or it's going to go away. It might not, and the best thing to do is to have it seen before it's a problem. And if you can see the slide, you can see that the risk of having breast cancer when you're young is really very small. But the most common age for having breast cancer is really around your 50s and 60s. It goes off a little bit towards your 70s because you don't have much breast tissue left by then. Family history. Now, this is what we call the Angelina Jolie effect. She brought family history of breast cancer to the forefront. There are 3 genes really, that they have isolated that increase your risk dramatically for getting breast cancer. And these are inherited. They're inherited through both your mother and your father. So it's not just your mother's family history that's important. because you get half your genes from your mother and half your genes from your father. So if you have a strong family history with your father's sister and his mother and some of his cousins having breast cancer, it is really quite a relevant family history. Although the most relevant family history is if your mother or your sister have breast cancer. It's a first-degree relative that is important, but not all breast cancers, because you have a family history, are an inherited risk. So only about 5 to 10% of breast cancers you can trace through genes that you would need to do something about the family history risk. Most breast cancers are what we call sporadic, they just appear. What are other risks? Well, the younger you are to start your periods, and the older you are to go through menopause, it's a risk. But in fact, you can't do anything about those risks. The age you have your first baby, we are programmed to have babies in our 20s, and that's the right time to have them. Once you get to your mid-30s, then the risk of developing breast cancer is slightly higher. But I always tell my patients it's not a reason to have children if you don't want them. Oral contraceptives. It is a risk if you take oral contraceptives for more than 4 years, but in fact, this risk tends to be more in the teenage girls that are taking it. And there are more and more teenage girls taking the pill not as a contraceptive, but to stop acne. And that is, I'm sure, increasing risk slightly. And it is something that we are starting to be a little concerned about. In fact, that risk is slightly higher than having hormone replacement. There's been a lot of talk in the press about hormone replacement therapy and breast cancer. It can increase the risk. Very small increase in risk, and it tends to be if you haven't had your uterus removed, when then you have to have what we call the combined pill. You have to have estrogen and you have to have progesterone, and those two combined are not good for the breast. Just estrogen alone really doesn't increase your breast cancer risk at all. Lifestyle. It's an interesting thing, but we know that breast cancer is a disease of affluent societies. It's a disease of first world countries rather than third world countries. It does occur in third world countries, but not quite so much. And we think this is possibly due to diet, because the more affluent you are, the better diet you have, the more calories you have, possibly more fat. But certainly that is producing an increased breast cancer risk. And we know when you have breast cancer, one of the best things you can do to reduce your risk of it coming back again is to exercise and reduce your weight. So there is a lot more to diet and exercise than we're fully understanding at this stage. Which that comes in with the obesity. There has been a lot about alcohol intake as well, and it's like smoking. It's one of those lifestyle choices that you must try and reduce. I know for this community I'm talking to, alcohol is not a problem, but you know, in the general community, it can be quite a problem. If you've had cancer of one side, there is a risk of getting cancer on the other side. It's higher than the general population, and it's one of the things we look for when we screen people when they come for their routine checkups. And benign breast, if you've had a lump, even if it's benign, you are slightly higher risk for developing breast cancer in the future. But all these risk factors are interrelated, and we can't pinpoint somebody who's going to have breast cancer. And most of the people who have breast cancer have no risk, do everything right. So, really, it's a matter of luck to a certain extent. So what do we do to try and pick up breast cancer early? Because that's the thing we have to do. And one of the things I try and tell people to do, it really is up to everybody to get to know how they are. And this is with breast cancer self-examination. It's very important to learn how to examine yourself. You can go to a physician and get them to examine you, but in fact you know yourself better than anybody else does. And mammograms, and I'll come to that in a minute. So how do you do breast self-examination? Well, the first thing you do is look at yourself. Women hate looking at themselves, they really do, but it's very important to stand in front of a mirror and look at yourself and make sure that everything looks the same, both sides. You have two sides that should look pretty much the same. And then you raise your hand over your head, and what you're doing is looking to make sure that both sides move equally and there isn't an area that moves differently from the other side, or there's no skin dimpling, or there's nothing abnormal. And then, basically, with one hand behind your head and the opposite fingers of your hand, you just run your hands lightly over the breast, and you have to start from the collarbone, go all the way out to the side of the breast, go into the middle, and just down below the breast. And you do that on both sides. The best time to do it is probably in the bath or shower, because your hands are nice and soapy. You can feel things. People say to me, but I can feel everything. You can. What you're trying to do is to get to know how you feel and note any change that you're going to pick up. And if you pick up change, then somebody's got to take it seriously. That really just goes through that. Now, what are the warning signs of breast cancer? Because when you do breast self-examination, you're looking for something. First of all, you're looking for a lump. And lumps may be quite easy to feel, like a marble, or they may be very indistinct, just a difference in the two sides. You may get one breast that becomes a little bit lower than the other, or a little bit bigger than the other, and this is a gradual effect. Most women have asymmetrical breasts, but if this is a new thing, if it's a persistent thing, if you have an area around the nipple, an irritation on the nipple, skin changes around the nipple, it may be something serious. If you lift your arm up and see little bits of dimpling in the skin, so the skin pulls in, then that may well be worrying. If you feel a lump either under here, under your arm, or your arm starts swelling up, you need to go and see your doctor. If you have a discharge from the nipple, particularly if it's spontaneous and you don't have to do anything to make it come, it really is important to go and have to check up. Now, many of these may well not be related to cancer. The whole thing is early diagnosis. Now, as well as self-examination and examination, we screen. And there are various ways we screen, but the best one is a mammogram. So what is a mammogram? A mammogram is an X-ray. It uses ionizing X-rays. It's a very low dose, so you're not going to do any damage by having it. So, and you have the X-ray going through the breast to try and pick up a lump. Digital mammograms are actually the same as normal mammograms. All a digital mammogram does is put the image through a computer, so you can actually enlarge and see the image better than anything else. So there's nothing fancy about digital mammography. Digital mammography is better for dense breasts, younger women, than normal mammograms because you can manipulate the picture. Mammograms are the only thing that have been shown to reduce death rate from breast cancer. If you screen a population of women and you're going to pick up 1 or 2 mammograms which may save the person's life, but mammograms are screening tools. Screening is looking at population. If you have a mammogram, it's not really screening. What you're doing is just being sensible. I have a lot of people ask me, well, ultrasounds are a lot more comfortable. Why can't I just have an ultrasound? An ultrasound is putting sound waves through the breast to pick up a lump. They are used in conjunction with a mammogram to pick up things that you can't see so well through a mammogram. But they're not a very good screening tool because they're very dependent on the person who does the mammogram. And also they can miss things because you're not looking at the whole breast at once. And none of the studies have ever shown that they reduce any death rate. So that is important as well. And the third modality that people know about is what we call an MRI, magnetic resonant imaging. What that uses is a very powerful magnet to produce an image of the breast. And certainly in certain cases, particularly if you've had breast cancer and if you've had the breast treated with radiation, MRIs can be more accurate. They can be more accurate if you have a genetic risk, if you carry one of those abnormal genes. But again, they haven't shown to reduce the death. They're also extremely expensive, so we don't use them as a routine for screening, even though they're not nearly as painful as mammograms. So who should attend for screening? When anybody who's over 40 should really start coming for routine checkups on a yearly basis. You should have a screening done. If your first-degree relative is under 40, then we normally suggest about 5 years younger than the youngest. So if your mother, for example, had breast cancer at 38 or 37, then maybe you should be coming in your early 30s. But on the whole, 40 is an average age to start. We usually do a single mammogram at that stage and a routine examination. You don't start having regular yearly mammograms before you're 50, but at least it gets you used to examining your breast and questioning any lump and finding out what is the changes in your breast. Also, as you go through these 40s and 50s, your breasts change because your hormones are changing, and sometimes it can be quite worrying. And what I want to do is just leave you. This is my last slide, really. In fact, 1 out of 10 women in the Western world, the figures for South Africa are 1 in 31, will get breast cancer at some point during their lifetime. 8 out of 10 women find lumps themselves. So breast self-examination really is very important. 9 out of 10, and 8 out of 10 are non-cancerous, actually. But what is the most important is the bottom line. is if you pick things up very early, 9.5 women out of 10 are going to be alive and well 5 years from diagnosis. Thank you.